Welcome to Damal Consult Career Academy. In today's video, we are going to cover some of the most common healthcare assistant interview questions and answers to help you stand out and get hired fast. Whether you're applying for your very first healthcare role or looking to move forward in your career, the tips and sample answers we'll share will give you the confidence to impress hiring managers. So, if you want to secure your dream job as a healthcare assistant, make sure you watch this video to the very end. Asterisk. 1. Can you tell us a little about yourself and why you want to be a healthcare assistant? I am a caring, patient, and hardworking person who has always been drawn to helping others, especially those in vulnerable situations. Over the years, I have gained both personal and professional experiences that have shaped my passion for healthcare. I find deep fulfillment in knowing that my support can ease someone's pain, brighten their day, or make their recovery smoother. I want to be a healthcare assistant because the role allows me to be hands-on in delivering essential care while also being a source of comfort and encouragement to patients and their families. I believe that every patient deserves dignity, compassion, and respect, and I am motivated to provide that in every task I undertake, whether it's assisting with daily activities, providing emotional support, or helping the nursing team. For me, this role is not just a job. It is a calling that gives me the opportunity to make a positive impact in people's lives every day. 2. What do you understand about the role of a healthcare assistant? A healthcare assistant plays a vital role in the healthcare system by bridging the gap between patients and medical professionals. The role involves a variety of responsibilities such as helping patients with personal care, including bathing, feeding, and dressing, as well as supporting mobility and ensuring comfort. Healthcare assistants are also responsible for monitoring and recording vital signs like temperature, pulse, and blood pressure, which provide important information for nurses and doctors. Beyond these physical tasks, the role requires providing emotional support and reassurance, especially for patients who may feel anxious, lonely, or vulnerable. A healthcare assistant must also follow strict health and safety guidelines, including infection control practices, to ensure a safe environment for everyone. In essence, the role is about providing holistic care, meeting both the physical and emotional needs of patients while supporting the wider healthcare team in delivering high-quality care.
Before we proceed further in this video, are you preparing for a healthcare assistant interview and want to feel 100% confident? Then you need our powerful guide, 50 Healthcare Assistant Interview Questions and Answers, the ultimate ebook to help you succeed. It's packed with real, detailed, and expert-approved answers to the most commonly asked questions. And guess what? It's very affordable, and right now you can get it at a massive 70% discount. To download your copy, just click on the sealer or fourth wall link in the description box below. Plus, we're currently running an exclusive bonus offer: buy one, get one free. When you purchase any of our ebooks, you'll receive one additional ebook of your choice for free. Just send us an email or WhatsApp message after your purchase, and let us know which free ebook you'd like. We'll deliver it to you within 48 hours. Need more help? Send us a message to get a free PDF with 10 bonus interview questions and answers, available instantly to support your prep even further. You can also join our WhatsApp group to connect with others preparing for the same role. All the links are in the description box. Want personal coaching? Book a one-on-one interview prep session directly using the links in the description. To order now, visit sealer.co or click the fourth wall link below. For questions or support, chat with our online customer care team via WhatsApp or email us. Don't miss out. Get your copy today and ace your healthcare assistant interview.
3. What skills and qualities do you have that make you suitable for this role? I believe I have the right combination of skills and personal qualities to succeed as a healthcare assistant. Firstly, I am very compassionate and empathetic, which allows me to build trust with patients and provide care that respects their dignity and individuality. I am also a strong communicator. I can listen attentively to patients' concerns, explain things clearly, and pass on accurate information to senior staff. I am physically fit and able to handle tasks such as lifting or assisting patients safely. Another important quality I bring is patience, which helps me remain calm when caring for patients who may be distressed or uncooperative. I am also very observant, which is essential for noticing small changes in a patient's condition and reporting them promptly. Finally, I am highly reliable and a team player. I understand that healthcare is about collaboration, and I am always ready to support my colleagues to ensure patients receive the best possible care. 4. How would you handle a situation where a patient refuses care or becomes difficult? If a patient refuses care, I would approach the situation calmly and respectfully, understanding that patients have the right to make choices about their care. My first step would be to listen carefully to the patient and try to understand the reason behind their refusal. Sometimes patients may be in pain, feel anxious, or not fully understand the purpose of the care being provided. By showing empathy and explaining the benefits in simple and reassuring terms, I may be able to ease their fears and encourage cooperation. For example, if a patient refuses to eat, I might gently explain the importance of nutrition in their recovery and offer an alternative meal that they prefer. However, if the patient continues to refuse, I would respect their decision while ensuring that the nurse or supervisor is informed so the situation can be monitored. I would never force care on a patient, as building trust and maintaining dignity are always more important. 5. Can you give an example of when you worked as part of a team to deliver good care? In my previous role, I worked with a team of nurses and healthcare assistants to care for an elderly patient who was recovering from surgery. The patient had very limited mobility, which required frequent repositioning to prevent pressure sores. This was a task that could not be done alone, so teamwork was essential. I worked closely with my colleagues by helping to prepare the necessary equipment, ensuring the patient was comfortable, and coordinating our movements during repositioning. Together, we were able to deliver safe and effective care without causing discomfort to the patient. In addition, we communicated regularly about the patient's progress and needs, which made the process smooth and efficient. This experience taught me that successful care delivery depends not only on individual effort but also on trust, collaboration, and effective communication within the team.
NHS Healthcare Assistant interview soon? I found the perfect prep. This ebook with 200 real NHS questions and answers. It covers values-based, scenario, and competency questions with model answers and insider tips to boost your confidence. Limited time, 70% off, buy one, get one free. Order now on Fourth Wall, link in the description. Secure your future today.
6. How do you maintain confidentiality when working with patients? Confidentiality is one of the most important aspects of healthcare, as patients trust us with very sensitive information. I make it a priority to always protect that trust. I never discuss patient information with anyone who is not directly involved in their care, and I avoid talking about patients in public spaces where others could overhear. I also ensure that patient records and documents are kept secure and only accessed by authorized staff. For example, if I need to update a patient's notes, I make sure I do so in the correct system and never leave documents lying around unattended. I am also familiar with data protection policies and follow them strictly to ensure compliance. By maintaining confidentiality, I not only uphold professional standards but also create an environment where patients feel safe, respected, and confident in the care they are receiving.
7. How do you deal with stressful situations at work? Working in healthcare can sometimes be very demanding, especially when there are emergencies or several tasks that need to be done at once. I deal with stress by staying calm, focused, and organized. I always try to prioritize my tasks, starting with those that are most urgent, while still being flexible enough to adapt to sudden changes. Communication with my team is another important way I handle stress. If things are very busy, I make sure to update colleagues so that we can support one another and share the workload. I also rely on empathy and patience to stay calm when working with distressed patients, because reacting with frustration only makes the situation worse. Outside of work, I manage stress by practicing self-care, such as getting enough rest, eating healthy, and taking time to relax. These habits allow me to stay balanced and perform at my best, even in stressful situations. 8. How would you support a patient who is anxious or upset? When a patient is anxious or upset, I approach them with patience, kindness, and empathy. My first step would be to listen to them attentively, without interrupting, so that they feel heard and understood. Often, patients feel calmer when someone takes the time to listen and acknowledge their feelings. I would also use a calm and gentle tone of voice, reassure them about their safety, and explain things in simple terms if they are worried about a treatment or procedure. For example, if a patient is nervous about taking medication, I might explain how it will help them feel better and remind them that the healthcare team is there to support them. Sometimes small gestures such as offering a glass of water, holding their hand, or engaging them in light conversation can make a big difference. If I felt that the patient needed further support, I would involve a nurse or another healthcare professional. My goal would always be to help the patient feel comfortable, valued, and supported during their care. 9. Why is infection control important, and how do you follow it in your daily work? Infection control is critical in healthcare because it prevents the spread of harmful bacteria and viruses, protecting both patients and staff. Many patients in healthcare settings already have weakened immune systems, which makes them more vulnerable to infections, so strict hygiene practices are essential. In my daily work, I follow infection control measures by washing my hands regularly, especially before and after providing care, wearing personal protective equipment such as gloves or aprons when necessary, and ensuring that surfaces and equipment are cleaned properly. I also make sure that waste is disposed of in the correct way and that I adhere to all infection control policies in the workplace. For example, if a patient has an infectious condition, I would follow isolation procedures carefully to minimize the risk of spreading it. By consistently applying these practices, I help create a safe environment where the risk of infection is kept to a minimum.
Healthcare interviewers aren't actually testing what you think they are. Interviewers want to see how you'd handle real situations, like what you say when a patient's family is upset. Get 50 Healthcare Assistant interview questions and answers. Your guide to acing interviews. 70% off and buy one, get one free for a limited time. Order now on our Fourth Wall store. Link in the description. Unlock your dream healthcare job.
10. Where do you see yourself in 5 years? In 5 years, I see myself continuing to grow and progress in the healthcare field. I want to gain more experience as a healthcare assistant, develop advanced skills, and possibly train for higher responsibilities, such as becoming a senior healthcare assistant or studying further to become a nurse. My goal is to keep learning and improving so that I can provide even better care to patients and contribute more to the healthcare team. I also hope to take on mentoring responsibilities where I can guide new healthcare assistants and share the knowledge I have gained. Ultimately, my vision is to build a long-term career in healthcare, where I am always motivated by the desire to help people, provide compassionate care, and play a meaningful role in improving the lives of patients. Do you have any question for us? Yes, thank you for asking. I do have a few questions. Could you please tell me more about the typical day-to-day responsibilities of a healthcare assistant in this facility and how the team is structured? I would also like to know what training and development opportunities are available, as I am very interested in growing within the role and continuing to build my skills. Finally, I would be interested to hear how you measure success in this position and what qualities you value most in a healthcare assistant on your team. And that brings us to the end of our guide on healthcare assistant interview questions and answers. I hope you found these tips helpful in preparing for your next interview. Remember, the key to success is practicing your answers, staying confident, and showing genuine compassion for patient care. If you enjoyed this video, don't forget to like, share, and subscribe to Damal Consult Career Academy for more career tips and interview preparation guides. Drop a comment below with the job role you'd like us to cover next. We'd love to hear from you. Best of luck with your interview. You've got this.